In a UK hospital in 2023, something disturbing became routine. Radiologists would arrive for their morning shift to discover that their new coworker, an AI called QXR, had already reviewed every single chest x-ray from the overnight emergency room. And this AI was catching something human doctors had missed 20% of the time. Let that sink in. 1 in 5 serious findings, fluid buildup, lung collapses, suspicious shadows that overwhelmed ER teams had marked as normal were being flagged by an algorithm that never sleeps, never gets tired, and doesn't care about your medical degree. So when people ask, will AI replace healthcare jobs? They're asking the wrong question. The real question is, which parts of healthcare are already being automated? Which jobs are transforming right now? And what does that mean for the humans who used to do that work? Today, we're taking a global tour of the healthcare AI revolution, from Hungarian hospitals to California clinics, to show you exactly what's happening, which jobs are changing forever, and how to make sure you're on the right side of this technological divide. Let's start with the least glamorous, but most transformative area, healthcare administration. If you've ever wondered where your health insurance premiums actually go, about $740 billion, that's with a B, flows into administrative work annually in the US alone. That's a mountain of money so massive it's attracting every AI startup with an algorithm and a dream. And they're coming for the paperwork first. Take Kaiser Permanente. They just rolled out Abridge's ambient documentation AI across 40 hospitals and 600 medical offices. This thing listens to doctor-patient conversations and automatically writes the clinical notes. Not in days, not in hours, while they're still talking. The result? Doctors at Mass General Brigham reported something miraculous during their AI scribe pilot, a 40% relative drop in burnout. That's what happens when you give people their evenings back. But surely the complex billing and insurance work requires human nuance. Think again. AI is now eating the $18.8 billion back-office revenue cycle management market. These systems automate everything from claim submission to fighting denial-happy insurance algorithms. What does this mean for the humans? If your healthcare job involves moving information from one form to another, you're basically playing a very boring game of transcriptionist while AI slowly takes your chair. The era of the medical secretary as we know it, let's just say they might need to rebrand as AI workflow supervisors. Now let's talk about the really controversial stuff, AI in medical diagnosis. This is where the white coats get nervous. Our opening story about QXR and the NHS isn't unique. At Semmelweis University in Hungary, they built AI models that predict hospital readmissions using nothing but anonymized patient data. The system integrates directly into clinician workflows via a simple REST API, because even AI knows doctors won't adopt anything that requires extra clicking. But here's where it gets cinematic. Imagine an AI that can detect 64% of epilepsy brain lesions that radiologists routinely miss. Researchers trained one on MRI scans of over 1,100 adults and kids globally. One doctor described the challenge as like finding one character on 5 pages of solid black text. The AI found 2/3 of what humans consistently overlooked. But, and this is crucial, AI in diagnosis has a very specific job description. Assistant, not replacement. These systems don't diagnose. They just say, hey, this scan might need another look. They're the world's most overqualified second opinion. At the NHS hospital using QXR, the AI runs automatically on every chest x-ray as a backstop, especially useful at night shifts when human experts are scarce. So what happens to radiologists? They're not being replaced, they're being upgraded. Instead of spending hours staring at scans, they're focusing on complex cases where human judgment matters. The algorithm handles the grunt work, the doctor handles the doctor stuff. Now let's address the elephant in the room. Are we getting robot nurses? Short answer, no. Long answer, hell no. But they're getting incredibly smart assistants. Consider sepsis, a deadly infection that kills roughly 350,000 Americans annually. Catching it early is everything, but most hospital alert systems are so noisy, they cause alert fatigue. Doctors start ignoring them like car alarms. Enter Composer at UC San Diego Health. This AI watches patient data in real time, vitals, labs, historical patterns, using a neural network trained on 6,200 patient records. But here's the genius tweak. If the model isn't confident, it says so. Low confidence cases get labeled indeterminate instead of triggering false alarms. The result? After rollout, they saw a 17% drop in sepsis mortality. This isn't just an algorithm, it's a colleague that knows when to speak up and when to shut up. Even surgeons, the rock stars of medicine, are getting AI sidekicks. Microrobotics enhance precision, but the actual cutting, still human-led. As one analysis noted, being a surgeon requires the ability to connect with the patient on so many different levels while taking a vast number of factors into consideration at the same time. Translation: the job isn't going away, but the tools are getting exponentially smarter. If you're a healthcare worker who thinks AI can't touch your job because it requires human connection, you're half right. The connection part is safe. The rest, you might want to check what your AI assistant learned overnight. So, if AI is taking over the boring stuff, what's left for humans? Actually, some pretty fascinating new careers are emerging. McKinsey's 2025 Tech Trends report identified the rise of agentic AI, systems that can plan and execute multi-step workflows. Think of them as digital coworkers that can orchestrate care coordination across electronic health record systems, automatically schedule follow-ups, order labs, and flag anomalies without human intervention. But these AI agents don't run themselves. Somebody has to train, manage, and troubleshoot them. Cue the healthcare AI job boom. AI trainers for clinical systems, humans who teach AI to understand medical jargon, recognize rare conditions, and stop hallucinating diagnoses, basically medical school for algorithms. Healthcare AI ethics officers, the conscience of the algorithm, making sure AI doesn't perpetuate biases or make deadly autonomous decisions. Human AI collaboration specialists, workflow designers who figure out the perfect handoff between human clinicians and AI tools. Clinical prompt engineers, doctors who discover that writing, "Analyze this MRI like you're a radiologist with 20 years of experience," gets better results than "read scan." The skill gap is creating incredible opportunities. According to industry analysis, 77% of new AI roles require advanced degrees, but that's starting to change as these positions become more specialized. The bottom line? Healthcare is adding AI literacy requirements to virtually every clinical role while creating entirely new categories of tech medical hybrids. So let's answer the original question. What jobs will AI replace in healthcare? The uncomfortable truth is that AI will likely replace tasks, not entire jobs, at least in the short term. But when you remove enough tasks from a job description, what's left starts looking like a different occupation entirely. The most vulnerable roles share three characteristics: high repetition, low human connection, and clear patterns AI can learn. Meanwhile, the safest bets require exactly what AI lacks: genuine empathy, complex judgment calls, and the ability to connect with patients as human beings. Think psychologists, psychiatrists, surgeons making life and death decisions, and medical leaders who inspire teams. Here's the reality check. Healthcare is deploying AI at more than twice the rate of the broader economy. 22% of healthcare organizations have implemented domain-specific AI tools, a 7x increase over 2024. This isn't future speculation, this is what's happening in hospitals right now. The question isn't if your job will change, it's whether you'll change with it. So here's my question for you. Where do you see yourself in this AI-driven healthcare future? Are you the radiologist who fights the algorithm, or the one who learns to leverage it? The administrator who clings to paper forms, or the one who masters the AI billing system? The healthcare AI revolution needs humans, just humans who understand that their most valuable skill isn't what they know, but how they adapt. Speaking of adaptation, if you're working in healthcare right now, I want to hear your stories. What AI tools is your hospital implementing? What changes are you seeing day to day? Slam that comment section below with your experiences, the good, the bad, and the downright terrifying. If this video sparked more questions than answers, do us a favor and hit that subscribe button. We're just getting started on mapping the wild frontier of AI in healthcare. Now, if you'll excuse me, I have an appointment with my AI primary care provider. What could possibly go wrong?